If you were coming to my office and you had cavities all around your mouth, it doesn't matter if you have one cavity or 15 cavities. If they're all at the same stage, they will all heal simultaneously. My goal is to save you from unnecessary dental treatments. And the problem with this goal is that you will never know what I saved you from. And that's perfectly fine with me. That's my delight. But there is a sequence, there is a pattern that occurs, and the normal pattern is actually recorded. If you go into the statistics and look at the number of fillings that, for example, teenagers have at 17 years old, 17 to 21-year-olds, and then you see that the more fillings get done as people age. When they're 30 to 50, they have yet more fillings. And then the number of fillings and crowns and work that's done in seniors. And what we see is that the amount of work done keeps increasing. And what happens if you look even closer at these statistics is you'll see that a filling that begins as a single surface, one surface filling, can easily become a two-surface filling and finally a three-surface filling or a crown as somebody goes through life. In other words, let's do the translation of this. Teeth deteriorate and need more work and more fillings year after year after year. And if I'm going to help you have a conversation with your dentist, my hope is that you'll be able to stop and avoid these fillings. Hopefully, at the first stage, at the very first filling, when somebody says to you in a dental office, it's just a small filling, that should ignite all your senses. And you should then return to this video and look at it again and see if your situation would fit for you to reverse this small filling and avoid having one in the first place. You see, even if you've had a filling, it's important to try to protect that tooth using, I'm going to suggest, my complete mouth care system with regular use of xylitol, controlling your habits, using this system of care morning and night so that you prevent any more work being done in your mouth. We know that with today's technology, we can detect cavities. One of the things that Kodak came up with when the Kodak camera fell apart, they were very clever. They came up with intraoral cameras and marketed to dental offices. And one of the things these cameras can do, and one of the things today's very sensitive equipment can do, is detect early stages of cavity formation. And I was excited initially because I thought this would be a wonderful tool so that people could go away and repair the area that was damaged and avoid the need for filling. But I looked back, and this has been about 15 years now since this very high-powered equipment of different kinds was developed. It's just being used to start filling teeth earlier, especially in America. So I want patients to be empowered. I want patients to be able to say to their dentist, do I really need, and the emphasis is on the word need, a filling? And if you're going to have this conversation about fillings, then we need to have conversations about cavities and caries. And what is the difference between a filling, a cavity, and dental caries? So that's what I hope to explain today. And you'll see as we go through this that there is a point where, yes, a filling probably is necessary. But there are plenty of places before that where we can reverse a cavity. We can get rid of that cavity by actually dealing with the caries, the dental caries, which is actually the infection that causes the hole in your tooth. And if we can do that and give ourselves enough time, not a lot of time, but enough time, that tooth can heal itself. And if you can do that, you will return to having a pristine tooth, a tooth as good as any tooth that ever was in your mouth. And This is what I wish for you. I also think we should begin by understanding that most cavities, we used to think they took 2 to 3 years to form. We now know that in most cases, it's about double that time. And so you have plenty of time, usually, to wake up and decide, I'm going to do this. I'm going to use Dr. Ellie's complete mouth care system, and I'm going to avoid cavities and fillings for the rest of my life. Because you can make that decision. This is not something you're born with. It's not genetic. It's not just occurring. It is a process. And that's what I want to talk about right now. What is the process of your tooth ending up needing a filling? Well, the process begins with, as I mentioned, an infection. Yes, in the biofilm, in the layer of bacteria that coat our mouths, there are bacteria that come along and they can process sugars and carbohydrates, and they will form acids from those sugars and those carbohydrates. And when they are stuck against your tooth, these acids are going to demineralize. They're going to pull minerals out of your tooth, leaving an area of porosity, an area that is demineralized in the side or in the top of your tooth. Those are the two places where this usually occurs, and they occur there because the debris, the plaque bacteria, often actually lay on the sides of teeth or in the grooves in the top of teeth. And where you have this accumulation of bacteria, that is where you get this demineralization occurring in the surface of the enamel underneath. Now, you can take an X-ray, and on an X-ray, this area of demineralization will look like this. It will look quite black. It will look like a hole. But it is really channels, lots of little channels where the minerals have been pulled out of your tooth, and it is not really a hole. As a dentist, I know that many, many times what looks like this big black hole on an X-ray, when you come to actually get in and look at that, it's not a hole. It's just an area where the disease has started to attack the tooth. And in order to get that tooth to heal, there are processes that you have to go through to get rid of this disease, which we call dental caries. Dental caries is disease bacteria, these plaque bacteria, and the softened tooth, let's call it scientific mush, that has softened and created this area. And when a dentist goes in with a drill, he is going to drill out that area. And then in the space that he has created, he will clean it up, and then he's going to put a filling to make the tooth look like a tooth again, to make the tooth function and look like it did before. But now this will be either a white or a silver filling. The thing is that at this stage, you, if you wanted to, can stop the disease. You can stop the plaque forming so you don't get any more plaque drawing acids into the tooth. And you can then remineralize the surface of your tooth and the underneath part of your tooth so that minerals get put back in and the tooth becomes completely whole again. Now, most dentists, certainly in Australia, New Zealand, and countries where there is socialized medicine, they will never usually drill into enamel. They know the value of demineralized enamel, that it still has structure, and that if you work quickly, you can easily repair this with the correct use of the products that I recommend as the Complete Mouth Care System. The arguments come when you have this demineralized area going further into the tooth, into the dentin. And this is where people get quite scared, because dentists will say that if you don't do something about that, the nerve of the tooth is not so far away. And you could seriously damage the tooth and end up killing the internal nerve, which is here, if you allow the decay, the caries process, to continue. Now, if the nerve is at risk, you will be experiencing toothache. You usually, if you eat anything sweet or any carbohydrate or anything cold, you will feel pain, and you will feel pain for about 2 minutes. At that point, that would indicate that the nerve inside your tooth is affected, which is a very bad sign, because the chances are then that not only will you need this filling, but you will probably need a root canal as well, because when the dentist goes in to do the filling, there's a very good chance that he will upset the nerve on the inside of the tooth, or that that nerve is already upset and therefore needs to have a root canal done. Let's not dwell on that, but I do mention that the fact of the matter is, if the decay is that far and has already affected the nerve, the chances are that even when you have a filling done, that tooth is going to be problematic sooner or later, at some point. I believe, therefore, that the sooner you give your tooth the opportunity, as long as you are not in acute pain, as long as what you feel is maybe some sensitivity when you eat sugar, you are far better to make these changes. It's not going to work if you don't make these changes. But if you start using the products of my complete mouth care system, if you control your eating and drinking to meal times, that's the habit you have to control. And last thing at night, you do clean your teeth with the system, potentially you will stop the decay and you will reverse this. And you can go back and see your dentist and ask your dentist before you begin, how long do you think I can go away and remineralize my teeth? If you were coming to my office and you had cavities all around your mouth, it doesn't matter if you have 1 cavity or 15 cavities. If they're all at the same stage, they will all heal simultaneously. That's the cool thing. If you've been told you have 8 or multiple fillings that somebody is scheduling for you, why not go away and put some work into this for 3 months? 12 weeks to 24 weeks. Most people can arrest the disease and they will start remineralization, which will be a good thing even if the dentist decides he is going to fill that tooth. If you've spent the time interval from when it was detected to when you have your next appointment, you could turn things around. It is remarkable how quickly many teeth heal. Now, not all teeth. I can't promise everybody. If you have a huge hole that you can see in your mouth, no, that's not going to fill back in. We're talking about actually integral enamel that has the hole in it. If you don't deal with these, what happens is this whole chunk of tooth disintegrates. And that is really the caving in. A cavity is really the caving in of this part of the tooth. For that, you can still use my complete mouth care system, and your dentist, when he comes to fill that area, will be amazed how nice and healthy the surrounding enamel is, which is a wonderful thing. But you can't rebuild a great chunk of tooth. I have never said that, and I will never say that. But you really can remineralize decay areas, caries, carious areas, even if they go into the dentin, if you use the techniques that I recommend. And that is because some of those mouth rinses will go in deep. The xylitol will go in deep into that carious area inside the tooth. And the work will get done right inside that cave, right inside that demineralized channel. You can't do that with floss. You can't do that with oil pulling. You can't achieve that any other way that I know, except with the use of the products that I recommend. Each of those products has a usefulness, and I'm not going to run through it here, but they work together in synergy. And at the end of 6 months, you will probably find, even on X-ray, that what was looking like a big hole has repaired and remineralized to such a degree that you can see it on X-ray. You can see the enamel looking brighter. And if your dentist isn't telling you that, ask to see the X-rays. Try and compare the previous one with the current one. In most cases, you see the enamel looking way brighter and shinier. And that's because the X-rays are being thrown back at the picture. That's what makes it brighter, by the minerals that have now become embedded into your enamel as it's healing. And the only reason that it's dark where there is demineralization is because these X-rays are able to travel through the tooth and are not bounced back. That's why these areas of demineralized tooth look dark, and why when they start to mineralize, you will see that they lighten in color and eventually become bright again, completely healed enamel.